everyone. I'm Bastian. I'm from Indonesia, exactly from University of North Sumatera. In this morning, I'd like to present my presentation about thiamin and its application in patient with critical condition. For introduction, as we know that thiamin is an essential micronutrient and it is water soluble and involved in aerobic metabolism. And we know that we need this vitamin so our body can metabolize do it again. Okay. We need this vitamin so our body can metabolize and make an energy, and we can use it for our daily activities. And we know for a critical ill patient, there is some deficiency for vitamin, and it is correlate with increasing mortality and poor prognosis. For pharmacology, we know that thiamin play a role in make an energy in Krebs cycle. We know that thiamin as a cofactor for enzyme pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and transcatolase. And this is enzyme provide us with an energy or ATP. So this is like a scheme for the cell that Krebs cycle use this enzyme to produce energy, and if we lose it, and the cell will be dead. For pharmacodynamic, we know that thiamin absorb in transform through a phosphorylation process in active coenzyme, thiamin pyrophosphate, and it absorbed in jejunum at low concentration and involve phosphorylation process through an active transport system. And it passive diffusion absorb in high concentration. And in our nervous system, thiamin is transported from circulation blood to cerebrospinal and blood-brain barrier. And we know from this graphic from Smith line, the peak level for the concentration reach at 4 hours, even though we use an oral vitamin. So for the distribution, thiamin widely distributed in all body tissue, including breast milk, and thiamin transport occur through the blood, both erythrocyte and plasma, and bound to protein around 90 to 94%. So the metabolism occur in liver and active then produce active metabolite like thiamin pyrophosphate, thiamin monophosphate, and thiamin pyrophosphate. And thiamin diphosphate is the primary active metabolite which act as coenzyme in carbohydrate metabolism to transcatolase reaction. For the excretion, we know that thiamin half-life range between 9 to 80 days for daily consumption, and eliminate in kidney with the phosphorylation process. For the half-life appears to be variable and highly dose dependent, and excess of free form vitamin B, it will excrete in the urine. In regular dose, the secrete in the urine is unchanged form. For the source or recommendation, we know that thiamin source in meat, eggs, yeah, dry beans, and soybean. This is the source of thiamin that we can use to provide us with a good thiamin. This is for the recommendation for daily intake in infant and children and teenagers and adult. You can see this. For the side effect, actually, there is rarely reported for the side effect, but it's also we can see some effect like diaphoresis, pruritus, skin sclerosis, urticaria, nausea, and bleeding. And yeah, sometimes maybe there is hypersensitivity, but I think there is rarely reported for all of this side effect. For the brain metabolism that we know, thiamin need as a enzyme cofactor in brain metabolism, and around 80% total thiamin is in the neural tissue. And then thiamin affect the membrane cell for the structure, function, mitochondrial, and then synaptosomal membrane, and a lot of function for the cell. And thiamin is also internerve in synaptic transmission and play a role in cell differentiation, synapse formation, axonal growth, and myogenesis. Yeah, that's why this is, I think, very important because in critical ill patient, thiamin need to be used because of we know that sepsis still remain an infection in the world and is getting higher for mortality and morbidity. Uh, and in sepsis, like in Indonesia, I think there is a deficiency for this thiamin, and it make the sepsis getting worse. So the lack of thiamin, it's correlate with mortality, I think. So that's why we should give an administration like thiamin, like around 250 milligrams daily dose, so it can helps the cell to provide good energy. This is some of journal for in 2009. Yeah, this paper published, and they said there is no correlation between intake of thiamin and mortality with dead people or with survival or non-survival people. And then in 2010, this prospective study, it still said that there is no connection. But if they exclude abnormal liver function, so there is a correlation between thiamin and acidosis lactate. And after this, there is a lot of effort discussing about the role of vitamin B or thiamin, and a lot of thiamin in critical care, critical ill patient. And this is one of the uh, paper that discuss that um, they try to prove the combination between thiamine and ascorbic acid for septic patient. They see in this paper they show no significant difference in score SOFA or morbidity patient. So, but they found an increasing serum level of vitamin C and thiamine. And then this is another paper that said that they use hydrocortisone and then vitamin C and thiamine for septic patient. And they see that there is there is use of vitamin in this role of sepsis, and this is our uh, research. We try to connect if this vitamin thiamin and ascorbic acid for septic patient without corticosteroid, and we see the level of uh, matrix metalloproteinase and tissue inhibitory metalloproteinase as function for the cell, and we see that thiamin alone give a better advantage, better than ascorbic acid alone in this combination. That's why I think we should try to observe more about this thiamin that play a role in sepsis patient. And for my conclusion, thiamins cell metabolism and administration of thiamin supplemental should be considered as adjuvant therapy in critical ill patient and may improve outcome. And further research should be developed to determine the optimal dose and timing to achieve maximal benefit.